Did you know that a bacterium called H. pylori is present in half of the world's population? Yes, that's right. Helicobacter pylori, or H. pylori for short, is a common inhabitant of the stomach. While many of those infected show no symptoms and never develop problems, H. pylori can cause a host of digestive issues, including ulcers and, on rare occasions, stomach cancer. It remains a mystery why some people with H. pylori develop these conditions while others do not. So, how does one get infected with H. pylori? The bacterium is likely spread by consuming food or water contaminated with fecal matter of infected individuals. Once inside the body, H. pylori begins to alter the stomach and duodenum, the first part of the small intestine. It infects the protective tissue lining these organs, leading to the release of certain enzymes and toxins and triggering the immune system. This, in turn, may directly or indirectly harm the cells of the stomach or duodenum, causing chronic inflammation known as gastritis or duodenitis. With these protective layers compromised, the stomach and duodenum become more susceptible to damage from digestive juices, such as stomach acid. Despite the changes occurring within the body, most individuals with H. pylori-induced chronic gastritis or duodenitis exhibit no symptoms. However, about 5 to 10% of people develop more severe problems, including stomach or duodenal ulcers and rarely stomach tumors. Symptoms of ulcers can range from pain or discomfort in the upper abdomen, bloating and feeling full after eating a small amount of food, to nausea or vomiting, dark or tar-colored stools, and fatigue due to bleeding ulcers causing a low blood count. Diagnosing H. pylori can be achieved through several methods. Breath tests, known as urea breath tests, involve drinking a specialized solution that H. pylori breaks down, with the resulting products detectable in your breath. Stool tests can detect H. pylori proteins, while blood tests can identify specific antibodies that the body's immune system develops in response to H. pylori. However, the accuracy of blood tests has been questioned. Testing for H. pylori is recommended if you experience chronic stomach pain, nausea, active gastric or duodenal ulcers, or have a past history of ulcers. It's important to remember that while H. pylori is the most common cause of ulcers, not all patients with ulcers are infected with the bacterium. Treatment of H. pylori is advised for people with a history of peptic ulcer disease, active gastric ulcer, or active duodenal ulcer associated with the infection. Successful treatment can help the ulcer heal, prevent recurrence, and reduce the risk of complications such as bleeding. No single drug can cure H. pylori infection, and most treatment regimens involve taking multiple medications for 2 weeks. These generally include a proton pump inhibitor, which reduces stomach acid production to allow for healing, and 2 antibiotics to minimize the risk of treatment failure and antibiotic resistance. In summary, H. pylori is a common bacterium that can cause significant digestive problems in a small percentage of those infected. Its diagnosis involves a variety of tests, while treatment requires a multi-drug regimen. Despite its prevalence, the reasons why H. pylori causes conditions in some people and not in others remain unknown.